Dana Miller presents the 9th Annual Obesity Conference, a practical look at obesity, diabetes, and current strategies. Featuring Christian Zamora, CSCS, high-intensity interval training, exercise considerations for obesity.
I'm really pleased to present my colleague, Christian Zamora. I've worked with Christian now for 5 years, something like so about, yeah. So Christian is our chief exercise physiologist at the clinic that I work at. And he's worked in a variety of different things, working in almost every demographic. And his greatest fulfillment comes from working with those who are struggling with obesity, and he has incredible passion. He enjoys teaching and making genuine connections with people by helping them realize their true potential. So please join me in welcoming Christian Zamora.
Thanks, Dr. H. I'd like to start off with a story. It's going to help me illustrate a point here, because it's going to seem really unconnected. When I was about 11 years old, we went and visited my grandfather who lived up Northern California, and he took me and my older brother for a special golf trip. We got to go this really nice golf course, and we were super excited. Me and my brother talked about it the whole way up there, and one of the things we were really excited about was being able to drive the golf cart, right? As an 11-year-old, I mean, being behind the wheel of a motorized something was really, really cool. So when we got there, we kept asking about when we could drive the cart, and my grandfather was a little bit, wasn't inclined really to let us have the reins of the cart just right out the gate. But in our good fortune, he forgot something that he needed in the clubhouse. Because we needed to get on to the tee and start to keep on time, he relented and said, "Hey, Christian, why don't you drive the golf cart to hole number 1? And my eyes lit up, and I was super excited for 2 reasons. 1, I get to drive the cart. 2, he chose me first over my older brother. And that's usually not how it works, right? So I think he may have felt bad and said, I'll let the little guy have a chance. So this is my big opportunity to show everyone that I could do what it was that I said I could do. And so I drove very slowly at first towards hole number 1. And as I got further from the clubhouse, my foot got heavier and heavier, and I was now max speed with the golf cart. And as we're approaching it, I asked my older brother, I said, well, where do I park this thing? And whether he was upset or just being a classic older brother and sticking it to me, just dead silent, didn't give me any inclination as to where to park it. And so as I got closer to the hole number 1, I saw this hill with very nicely manicured grass and these 2 blue wooden blocks. And I thought in my brain, I said, that must be where you park your car before you tee off, right? Those who know golf are starting to laugh. So yes, I did exactly that. I drove up the hill. I did like a 3 or 4 point turn because I had to get it perfectly right in between those 2 blue wooden blocks. And I was sitting there with a big grin. And then until I heard screaming or yelling from the clubhouse, and I turned and heard my grandfather with a few choice words, waving his arms, and very upset. And I'm trying to process what is it that he's so mad about. And as he's getting closer, he's yelling some explicitives, maybe. Get the cart off the tee box. And again, for those who don't know golf, the tee box is where you take your first shot. Those blue dots are where you place your ball to hit that first shot. And golf etiquette, I mean, parking your car on the tee box is one of those unwritten things they assume people know not to do. But 11-year-old Christian didn't know that. I didn't get the wheel for the rest of the time. I had a ride in the passenger seat. But lesson learned, I haven't done that since. And the reason I share that story is to make a point that the right mixture of ignorance and arrogance can get you in a scary situation. And when it comes to high-intensity interval training, I think that as the current landscape with people engaging in HIIT training without proper indoctrination or education on the subject, they can put you in that scary position. My stepfather always says about things that they know just enough to be dangerous. And I think a lot of people know just enough to be dangerous with this modality for training. So one of the things that I want to do this morning is talk a little bit more about what high-intensity interval training is and what it isn't, who it's safe for, if it's beneficial for our obese population, and when we should recommend it or maybe not. So we'll define it, I said, explain safety concerns, understand the benefits, and here's some questions that I think I just would like you guys to ponder as we go through this. is what prior knowledge do obese persons need before engaging in high-intensity interval training? Is high-intensity interval training safe for this population? Does it produce better outcomes as opposed to traditional state steady exercise? And we'll talk more about what that is later in the slides. What environment and resources are needed to engage in this type of training? And does HIIT training increase or decrease the adoption of continuation of regular physical activity, which it really is the end goal, is getting people to adopt physical activity. So let's talk about physical activities. There's some slides that you've probably seen countless times, but we'll go over them just. Physical inactivity is one of the major risk factors associated with obesity, and we know this is independent risk factor for mortality. Exercise and effective strategy, of course, reduce weight and improve health. And it's an important intervention for weight loss and weight maintenance. And newsflash, exercise is good for you, right? 90% of participants in the National Weight Control Registry show that reporting weight with food restriction and physical activity is what's important to them and how they're doing so successfully. And we'll talk about later in the slides again why there's a big emphasis on and. So the World Health Organization recommendations, we've all heard this, 150 minutes a week of moderate intensity or 75 minutes a week of vigorous intensity. And later in the slides, we'll also discuss how sometimes it seems pretty general or pretty to the point of exercise recommendation, but how most of the population, when you say 150 minutes a week of moderate intensity, it's actually a very vague description for them, and they're having trouble understanding what that means. I mean, even sometimes just the basic math. You know, some people aren't big on numbers. I'm one of them. And it's like, okay, how many times a week, and figuring out a schedule can be hard. And then what is moderate to vigorous? Because we have our preconceived notions of what those might be, but what we'll see later is what the guidelines and what all the data that comes out to support this type of activity for health benefit is actually very different than what we think that they are. So the American Council of Sports Medicine recommends, though, that obese population progressively increase their physical activity to 200 to 300 minutes. As we see, it's pretty much twice as much as a regular recommendation for them to lose weight and for long-term weight maintenance. So going back to the topic of making sure that our patients are adopting the lifestyle of physical activity, they have to do it at a higher clip than most. So getting them into a routine and having it become a lifestyle thing is really what's important, because they actually have to do a high quantity of it. So let's talk about exercise intensity. We'll go over a few things just to make sure we're hip to some of the terms we'll use later. Vo2 Max is the maximum amount of oxygen the body can utilize during a specified period of usually intense exercise. Moderate intensity, 55 to 69, 70% of that Vo2 Max. Vigorous intensity, 70 to 89%. Near maximal intensity is 90% plus. So now I'm going to define them in terms. Again, that's kind of vague, and everyone goes, well, what's 55 to 69%? Of Vo2 Max. So it's going to vary highly on your physical condition and your amount of training that you are currently at. So what we'll do is I'll define it a little bit differently using something that I like to use with our patients. And that's just bringing it down really basic and wording it, how you feel. These are things you would say maybe if you were doing this type of activity. So if you're at moderate activity, you're thinking, whew, I'm getting a good workout. Now, my biggest my pet peeve with moderate intensity is that the talk test. Have we heard of the talk test with exercise? Right? Okay, so the talk test is, and it's very common, and people like to prescribe it out, and they said, well, the talk test is moderate activities are if you're able to talk while you're performing that physical activity, that is moderate, right? I see some nodding heads, so we've heard this. What I don't like about it is that the talk test is more for a submaximal of moderate intensity, and a lot of times, though, patients will do this at a minimum, meaning they're not even reaching 55 to 69%, but because they're passing the talk test, they think that that's moderate activity. So me casually strolling last night with Dr. Hernreid in the streets of Philadelphia, we weren't at moderate intensity exercise. It was exercise, but we were talking, we were laughing, really, really easy. The talk test should really be the just barely able to talk test. That should be the title for it. Right? And so if So if me and Dr. Hernreid, I'll use him because we work together. If we said, hey, let's go for exercise, in our Folsom location, we have a really nice walking trail next to a little creek and with a walking path. So if we were going to go get our exercise for the day, we'd go out there, and the conversation would sound like this as we started to walk. As we warmed up and reached moderate intensity, it would sound like, hey, how is your day going today? Oh, it's going good. Okay, good. All right. What's on the agenda for the rest of the day? So we're able to talk. It's a little bit labored. That's how we know we're around moderate intensity. Vigorous intensity, 70 to 89%. You're saying, wow, this sucks. And you're barely able to talk, meaning you're struggling, you're having a hard time. So now me and Dr. Hermit are feeling pretty good. He said, hey, let's pick it up. I said, okay. So we turned to jogging into more of like a brisk run, and we're moving. And then our heart rates are coming, our lungs are starting to burn a little bit, and we're not really wanting to talk to each other because we're starting to feel the pain, right? And we might get out as simple as like, hey, this sucks, right? And yeah, this is horrible. Why are we doing this? We're in our work clothes. We got to go see patients. Now we're getting sweaty. So that's where vigorous intensity at. Now, near maximal, and this one's really important to understand. Now, near maximal intensity is 90% plus of Vo2 max. This is what we're saying. Nothing. We're in so much pain that we don't want to talk. You forget that really the other person's there. If they say anything to you, you're probably getting mad at them for because you're in such a world of hurt. So we're saying gasping sounds. It's, they might come find me and Dr. Hernreid like keeled over, like laying down, trying to recover our breath. So anytime now when you're talking about prescribing, or maybe you're working with an exercise professional in your clinics, or you're recommending to them, I want you to, exercise intensity, I want you to think about me and Dr. Hernreid sprinting outside of our office. That's what near maximal intensity looks like. So now what this means in relationship to HIIT. So it's also known as sprint interval training or high intensity interval exercise. It's repeated sessions of relatively brief intermittent exercise performed at that VO2 peak or max that usually lasts a few seconds to a few minutes, because you really can't do it much longer than that, with periods of rest or low intensity exercise in between. Now, my media didn't transfer over, and I wish you could have saw this video, but if you're interested and you have some time to kill later, Google or YouTube a Wingate Test. And what a Wingate Test is, a test for Vo2 Max, and they put them on an exercise bike, and you warm up, and then you go for a sprint and an all-out effort against a resistance. And what they're looking to do is reach that maximal oxygen consumption that you can attain, and they measure that a lot for athletes. It's really, really cool. And with the test, the video, what is shown is how intense the two guys next to the guy on the bike get. They begin yelling and clapping and trying to encourage him because, again, he's in a world of hurt. And the guy on the bike, who clearly has a high physical fitness level, is going, and then at the end of it is just completely exhausted. You could see his counterparts trying to talk to him, but he is just kind of hunched over in a lot of pain. And again, I wanted to do this, and please check it out later, just to demonstrate what a near maximal or maximal VO2 consumption looks like. Now let's do that in contrast to what most of us do for exercise, or we see, and that's continued moderate intensity exercise, also known as moderate continuous exercise or traditional endurance training. It's continuous exercise of durations with no intervals or decreased intensity, right again at that 55 to 69% clip. And it has an increased volume compared to high-intensity interval training. And that's one of the things that attracts people to HIIT training. We'll talk about that later, is, hey, you can do it in a shorter amount of time because the intensity level is up. So those doing continuous state are going to be on that treadmill or on that elliptical or that bike for a lot longer periods. So some variables. Intensity is the percentage of VO2 max. There's variables. Again, these are for HIIT training. The duration of high-intensity intervals, how long you're going to be doing those intervals for, the number of intervals performed, is it between 4 to 10, duration of your rest period, and your type of rest. So there's an active rest where you're still performing low physical activity, or passive where you're just kind of hanging out. So we'll compare the two on this, and we'll just do it really quick. So here's, of course, the intensity differences, clearly different. Intervals, no intervals, duration, a lot longer time spent doing continuous, moderate, and exercise, and then recovery, no recovery. Safety considerations. So now that we know a little bit more about what high-intensity interval training is. Of course, there's safety considerations, because if, again, if you look at that video later, or just to imagine someone sprinting at a maximal effort, we're talking about the obese population, one of the fears would be, is that safe? And common sense would tell you probably not very safe. But again, we see a lot of our patients who, going back to what Jane just spoke on, they're getting their information and their health information from digital services, going online and Googling things or YouTubing how to lose weight fast, before they see us. Or if you're a male like myself, you're not even talking to your doctor. You're going, I'm going to fix this problem, or do the avoidance mechanism, right? Like if I don't know that it's a problem, it's not a problem. And by the time it becomes a problem, I'm going to go solve it myself. So they go to Dr. Google. Dr. Google tells them about HIIT training, and they run into it. And we'll talk about how that can be not so great. So according to the ACSM, persons who have been living a sedentary lifestyle, periods of physical inactivity may be at higher risk for coronary disease with high-intensity training. Risk factors, of course, family history, smoking, hypertension, diabetes, hyperlipidemia, and obesity. Medical clearance is needed for anyone with these conditions. And it's important to establish a baseline level of fitness before trying HIIT training. Baseline fitness levels can typically be reached with consistent aerobic training 3 to 5 times per week at durations of 20 to 60 minutes per session. So risk of sudden cardiac death during vigorous activity in previously asymptomatic individuals is, of course, extremely low, because that is sometimes people jump to, is like, oh my gosh, we're going to kill people. And as you can see, that it's very, very low, nothing really to be concerned about, except for the population that we're talking about. Because if there is an episode, typically it's in the population of people that we work with. Rates of sudden cardiac death are disproportionately higher in the most sedentary individuals when they perform unaccustomed or infrequent exercise. And we see that when patients get excited. When I talk about patients' exercise, it's actually kind of fun to be in the room with them. And they come in, and you have someone who is actually really exercise adverse, or has low self-efficacy with exercise, or just is not really want to do it, but they turn this table because something in their life has changed, and they're like, hey, I want to do this exercise thing. I know that it's part of it. And they come in with this tenacity sometimes and go, let's run, let's go do it. I don't really want to run, but I want to do something, right? They're excited. But what people do, whether they're talking to me or anybody else, if they're not consulting with someone who can educate them about how to ramp an exercise program out, they can go out, and again, they know just enough to be dangerous, and hopefully not, but worst case scenario, they fall into this scenario that we're talking about here. So trigger mechanisms: increased wall stress from increase in heart rate and blood pressure, exercise-induced coronary artery spasm and diseased artery segments, and increased flexing of the atherosclerotic epicardial coronary arteries, leading to plaque disruption and thrombotic occlusion. So of course there's benefits. So we don't want to say, there's some safety considerations clearly, but there is benefits, or else this HIIT training wouldn't become popular. And people wouldn't be wanting to do it. We're getting some stuff out of it. One is increased Vo2 Max and cardiac function, improved insulin sensitivity and lower triglycerides, and enhanced lipolysis of fatty acid oxidation in the skeletal muscle. Compared to continuous moderate intensity, HIIT has proven to be a better method of improving cardiopulmonary fitness in the obese population. Similarly, it's superior in reducing risk factors for metabolic syndrome. Again, really, really good. So we're seeing some benefits. Now, we know that's good as healthcare providers, and we want to see these things, but a lot of times we also want to see our patients losing weight. And most often than not, when patients actually look to do exercise in an obese population, they want to improve health, but weight loss is a desired benefit as well. And so we'll talk about HIIT training and weight loss. So there's positive effects in this type of training and for cardiopulmonary and physiological functions. But its position as the optimal training modality for weight loss is a higher uncertainty. 2 recent studies using this HIIT protocol found no significant change in body weight composition in our population that we're talking about. Some studies do support higher levels of fat loss, but further research is needed for sure, nothing definitive. And this is what I think is important that we talk about right now is high intensity interval training in popular culture and how it's viewed by the public. So a simple Google search of HIIT, just those 4 letters, yields almost 11 million results in half a second. So there's a lot of information there about HIIT training. Social media, blog sites, and magazines are littered with fitness professionals, we put those in quotations, and fitness enthusiasts blindly prescribing and sharing HIIT workouts. Most have no specific guidelines for how to do these or what intensity variables are or what to watch out for or safety considerations. Also, with the type of training we talked about with perceived exertion and what actually is required to receive the benefits from HIIT training as far as intensity levels, most people who think that they're doing HIIT training actually never do it effectively and aren't getting the benefits because they're not reaching HIIT protocol, because they're not pushing their bodies to a state that they need to be in of that 90% plus of Vo2 Max. And the reason they're not doing it, again, like it said, because it sucks and it hurts. No one really likes to be in that kind of pain. There's a few people out there, but not very many. They give little to no precautions, like which can be super dangerous. And we talked about, too, that someone who's consulting Google for their exercise hasn't talked to their provider, and before this new bout of HIIT training, they've been untrained. We see how, again, that can be really scary and can lead to not so great outcomes. So most make bold claims and persuade the reader or user to believe they can get their desired results quickly. And this is what we're talking about. This is a topic that I'm extremely passionate about too, as someone who works with our patients, and seeing the stories of frustration when they come in and say, hey, I've tried this exercise thing on my own, because I don't know about you, but in our clinic, most patients actually will, of course, try to lose weight on their own, and when they're unsuccessful, they go, I need help. So they reach out and they go, I've tried this, and I've heard, this type of training is better than this one or this diet, and they're just so frustrated and overwhelmed. And there's a lot of information out there, like the gentleman asked the question earlier, with all the amazing information we just got on the innovations of technology. There's so many things, and they all seem so right, and they all seem so great, and they all can be for the right user, right? Or if you're in that stage of learning or life, to adopt those that work best for you. But for most of our patients, again, with people's putting stuff blindly out there, they don't know what's right. We have our fitness is a multi-billion-dollar industry, and they're amazing at sales. When we see these things, like that's why people buy shake weights, right? And if you bought a shake weight, sorry, because they sold them, they go, wow, like the benefits are amazing, and it looks like all I have to do is this. And when you hear HIIT protocol, it sounds good because they oversell one aspect and they undersell the other. And the part that they oversell is, hey, it's quick. You're busy. You don't have time. Who has time to do 30 to 60 minutes, or if you're obese, 200, 300 minutes a week of exercise? You can cut that in half or a quarter. All you have to do is work out a little bit harder. And there's the undersell, right? You have to work out a little bit harder during those times and do these intervals where you work out high and then you rest, and then you're done for the week. And that's extremely attractive, especially for a population that goes, I am stressed, I have stuff, we have life, other things that we're doing. Also who typically are exercise adverse, right? They're going, I've had bad experiences with it. If I can do less of it as opposed to more, I'll sign up for that. I can work out a little bit harder during those intervals. So then they go and they do it and they don't get the results. One, why? Because they're not doing it correctly. And two, we'll talk about later how it actually hinders their progression and their adoption of exercise as a lifestyle. So for most individuals with obesity, the adoption of exercise as a consistent lifestyle behavior is hindered by several physical, physiological, and environmental issues. Here's some of these issues. Of course, there's physical limitations with our population and comorbidities. There's a low self-efficacy, usually, with our population. Negative learning history with exercise. We talked about that. There's depression, negative body image or embarrassment. I had patients tell me, hey, you don't want to see me sprint. It's not pretty, right? We're not going to make you do it. Low social and cultural support, and high cost of quality training programs. These are real barriers. And I like the term when people say, like, hey, no excuses. I get that. I'm all for just jumping in and doing something and finding a way to win. But at the same time, when I work with patients, sometimes that no excuses mentality can be very damning to a patient, because they feel like these real life barriers and obstacles they have to overcome, it minimizes them and it makes them feel embarrassed, or it lowers their self-efficacy even more, the fact that they can't overcome them because someone's not walking through it with them, because these things are tough to navigate. So self-efficacy, we'll focus on this one, is one of the most consistent predictors of successful adoption and adherence to exercise. And as it relates to exercise, we're referring to the extent to which an individual believes they are capable of carrying out behavioral change And increasing self-efficacy will lead to an increased effort and time being devoted to the task. And we see that, right? It's the whole mentality. If I get some small wins, I build momentum, it keeps me engaged and excited, and I move forward. Lack of progress, there's nothing that kills momentum like lack of progress, like, trying really, really hard at something and not feeling like you're getting anywhere. And that's what we're talking about. On the other hand, too ambitious expectations may hinder success. High expectations of change in violation of these expectancies predicted lack of adherence and results in attrition. So taking it back to previous slide where we talked about, hey, Dr. Google prescribed HIIT. I'm ready to do this. It sold me that it's less time to work a little bit extra harder, but I'm supposed to see more fat loss and get results this way. They come into that exercise and they have two negative experiences. One, they realize if they're doing it correctly that it doesn't feel good, right, working out that hard, and no one likes to not feel good. So they start backing off. And then two, they're not, all those promises that they were promised by the fitness enthusiast or the fitness professional or the fitness evangelist, they're not experiencing it, and they're working their butts off. I mean, they really are trying. It's not like they're not doing anything. Or the benefits maybe are good at first, but then they wane, right? They go away. And that leads to this last part we're talking about here is, this is not really working. I'm working too hard. I got other things I need to be doing. Exercise goes away. And we see this, or I see this all the time with patients, and you've probably seen this too, and maybe even you've done this yourself, is what? When our fitness level goes down, we get to a certain point where there's the stimulus that tells us, hey, I need to improve my health, right? We didn't feel so great. Our belt's getting tighter. And then we get what? We go, hey, let's get excited. Let's go. I'm going to get back on my routine. I'm going 5-6 days a week, and I'm going to work out really hard. And again, we love the vigor. We love the tenacity. You're excited. But what they do is they catch fire, and they burn out in 2 to 3 months. And they're not seeing the results, going back to Amazoning, right? Amazoning our expectancies of, hey, I want to be leaner and stronger and faster now. I'm not there yet because I'm not doing the protocol the way I was supposed to, even though I don't know that I'm not doing it, right? Overwhelm, frustration. You disengage from exercise. And when people quit exercise, really any healthy lifestyle change, when we tell our patients, it's usually not a very intentional decision. It's a slow drift. It's, I missed yesterday's workout. I'll take today off too. This will be my down week or my bad week, my rest week. I'll start back next week, back on the routine. And they go, but then again, they miss another couple days or a couple days. And next thing they know, because they fill that time with other important things, right? It's not just downtime, but other important things that need attention. 2 or 3 months from now, they go, oh, that's right. That donation I've been making to the gym, do I really need to make that donation anymore? And we call it donation. Why? Because we're giving them money and not using anything with it, right? They cancel it, and we're done. So high-intensity overtraining, while proven to be generally safe and effective in improving health in the obese population, may not be the best training regimen for long-term adherence in the population of people we're talking about. Exercise enjoyment levels are low. It's impermissible for most of our population due to physical deconditioning and high appearance of contraindicating comorbidities. Lack of proven superiority in weight loss, fat loss, high attrition due to low levels of efficacy in pop culture's sensationalized expectancies. So the adoption of long-term physical activity requires the same effort, intentionality, and support as any other lifestyle altering change. Those looking to adopt physical activity need to desire a commitment to change. They need to have a proper physical readiness assessment, set real attainable goals, and discuss expectations of when they can see progress and what it looks like. Getting them involved in the planning process of their physical activity and making sure it's something that they like, they're going to adhere to, they're going to enjoy. And instruct and educate on training parameters of what their exercise looks like, being held accountable, and providing a support system. So in conclusion, we'll talk about a few things. Most obese people looking to adopt physical fitness don't have a clinical exercise setting. Legitimate fitness professionals or competency of themselves to correctly apply this type of protocol. And they may also have undiagnosed comorbidities that make HIIT a health risk. Additionally, sensationalized expectations in a population with traditionally low self-efficacy are likely to cause high attrition and abandonment of regular physical activity, which defeats the goal. Sometimes when we tell patients, because they really butt their head, sometimes they'll go toe-to-toe with me and saying, no, I really want to do this. No, I'm different. I'm going to do this higher activity because I was an athlete before. Or I have done this before. And we just talk to them about, I say, the amount of exercise you're going to do in the next 3 months is never going to give you the health benefits you need for the rest of your life. So it's okay if we take it slow. We're glad that you're excited, but pump the brakes a little bit. Let's draw this thing out and let's work at fitting this in. Instead of looking at type at first, let's look at where we fit this in your schedule. Let's look like, the real things of, I got to work at this time, so do you have a shower if you're going to do it before work? So those little things that sometimes we don't concentrate on that are ever important in making sure that it fits your life, your work, and your play. Just as, again, previously mentioned, how people want to absorb tech. It's everything. Exercise should be looked at the same way. We want it to meet our needs, and we got to find a place for it that looks the way, it's a type of exercise that we enjoy and that we're going to look forward to and that we receive benefit from, but also fits in our daily routine. So we need to have more multidisciplinary intervention aimed at increasing adherence to physical activity, encourage subjects to start with activity goals they can achieve and improve on. So we see that HIIT is a proven method for improving health in the obese population, but only recommended to those for fully who comprehend what is required and have consulted their healthcare providers. Secondly, participants must be safely able to execute HIIT and encouraged to do so in the presence of a qualified professional. And so there is a small subgroup of people who potentially could be doing HIIT training, but as you can see, the parameters for them to do that are pretty specific and more than likely not with our population of people. So if we're going to be doing this with somebody, first, of course, they need to get medical clearance that they're healthy enough for this type of exercise, that they have that baseline of fitness, perform a physical readiness assessment, discuss with an exercise professional expectations for training and their outcomes, and perform these type of sessions under the observation and coaching of a trained exercise professional until they're able to do it on their own. And the last little thing I'll kind of leave you with is going back to a point I made earlier about that underlining why and was underlined and highlighted, I think even bolded as well. When patients are in our practice, we often find that weight loss and exercise are always come married together. There's an expectancy that they're both done. But I always want to make the distinction that there's an and there, that adopting new healthy eating behaviors, the set of information, education that you need to learn about food, and what types of food, the skill set needed like meal planning and preparation is a completely different set of education and skills and behavior change than adopting an exercise routine, which has its own set of information, education, and skills that you need to adopt. And it's asking a lot of our patients to do both of those simultaneously when they're making huge lifestyle changes. Now, it's not to say that you can't do both at the same time. We often see people that don't, or people that do, but we also see a lot of people who fail with this, and a lot of times it goes back to this overwhelm. One of the things that I've been blessed with in our practice is Dr. Hernreid's kind of given me the full reign of the exercise protocol at the Hernreid Center, and one of the things that it was kind of counterintuitive to some of the people or the patients, and every time we say that to them, it kind of like blows their hair back. I'll come in as the exercise professional in the beginning of, let's say they're starting their weight loss journey with us, and I'll say, hey, if you don't want to exercise or you're not for it right now, that's totally okay. I actually don't really want you even focusing on it. There's a lot that you're going through right now and learning this nutrition part, and we know that has a bigger leverage point on the weight loss, so I want you to focus there. I will come and talk to you about exercise because I don't want it to diminish the fact that I think it's important that everyone should do it. I just understand that you might not be ready for it now. And it's completely disarming for them, and they say, oh my gosh, this guy's not going to come shove exercise down my throat, because again, talking about fitness professionals and things, there's an expectancy of that's what it looks like. And so we tell them, hey, when you are ready for this new skill set, when you feel comfortable and you kind of got your bearings with the nutritional aspect, we do want you to start introducing physical activity, because we do have the data that suggests 90% of our maintainers, right, those who have lost weight successfully and are keeping it off, 9 out of 10 of them say they're doing it with a combination of dietary restriction and exercise, right? So we're saying we want you to move there, but we want to give you the right environment to succeed because it's so important. I don't want you to do this now. So they get their bearings, they come in, and then the prescription oftentimes looks like, let's focus on time and place in getting to your activity rather than any part of the activity itself. And they go, what's that look like? It's like, all right, well, what can you commit to? 1-2 times a week? Some of them One time, one of my favorite ladies came in. She sat down. She closed the door. She sat in the chair. She turned around, like pulled it up really close to me and said, "I hate exercise. Good luck." And I said, "Thanks. Let's talk about it." And it was great, though. And by the end of it, you know, we got to a place where she said, "You know what? Okay, I'll give in." Purely because she's making a monetary investment in our program, she goes, I need to make change. I don't see how this is going to do it. I really do hate exercise. But if you say that I need to do this, I want to give this my best shot. So I'm going to do, you know, once a week. I will now walk to get to my mail instead of taking, she lived out in the country, instead of taking another golf cart story, taking my little golf cart down to get it. And I said, that's amazing. Let's start there. And one day a week turned to 2, turned to 3, turned to every day. Turn to longer walks or going visiting places. And now she's someone who enjoys exercise, which is really cool because it comes full circle. I had a patient walking out of a classroom, and I just had given a presentation about exercise. And patient said the very same thing. She didn't come out that abrasively and say that she hated it, but she said, "I've had bad experiences with exercise. I could never see myself doing anything like what you're talking about as far as getting to a place of doing it regularly. I don't enjoy it. I feel like I don't have the time for it." And that same lady I just happened to be walking by and just grabbed her, you know, softly on the back of the shoulder and said, "Hey, that was me 1 year ago," because now she's in our maintenance class and kicking butt. She goes, "That was me 1 year ago. I completely hated exercise. I gave this dude a really, really hard time about it. But now I'm exercising regularly. I enjoy it. It's helping me keep my weight off. And I just finished a half marathon at Disney, and I signed up for the next one already." And us as healthcare providers and exercise professional, that's what you do your work for, is what we're here for right now, is getting the information, equipping ourselves with tools and resources so that we can go affect positive change in our community and with our patients. And that's something to really get excited about. So thank you for your time.
This has been a Dana Miller Video Network presentation.